Hello, today we will be talking about SSRIs, also known as selective serotonin reuptake inhibitors. They are designed to increase positive responses in the brain and to combat negative ones. Hi, we are Jordan, Cameron, and Mackenzie, your hosts for this video. So we'll start with the background. What is an SSRI? SSRIs affect the serotonin levels in the brain. Serotonin is a neurotransmitter, meaning it carries different chemical signals to the brain. By affecting the chemical signals, the brain reacts differently and causes different emotional or physical responses. Serotonin has very special effects on the brain. SSRIs cause the reuptake pumps in the synaptic gaps to be less effective, leaving more serotonin to be sent to the brain. Serotonin increases positivity in the brain and works to cancel out the negative it is producing. Serotonin moves across the synaptic gap from the axon terminal inside of the synaptic vesicles, and as it crosses over the synaptic gap, it is picked up by the receptor sites and absorbed into the cell body. The serotonin is now accessible by the brain and improving its positivity levels. SSRIs are most frequently used to treat major depressive disorder, simply known as depression, but can also be used to treat obsessive-compulsive disorder, OCD. Too little serotonin can result in depression, and according to the Diagnostic and Statistical Manual of Mental Disorders, DSM-4, depression is defined as a period of 2 weeks or longer during which there is either depressed mood or loss of interest or pleasure, and at least 4 other symptoms that reflect a change in functioning, such as problem with sleep, eating, energy, self-image, or recurring thoughts of death or suicide. As of 2016, estimated 10.3 million U.S. adults 18 and over experienced at least one major depressive episode with severe impairment, representing about 4.3% of U.S. adults. SSRIs are commonly used as antidepressants, such as Prozac and Lexapro. The increased levels of serotonin in the brain often combat the effects of depression. Antidepressants were first developed in the late 1950s, marking a turning point in the treatment of depressive illnesses. During the 1980s and 1990s, selective serotonin reuptake inhibitors were developed for the treatment of depression. Although SSRIs have positive benefits to them, they are also known to have many intense side effects. SSRIs can cause nausea and drowsiness, headache, blurred vision, insomnia, and lead to heart arrhythmias. Prolonged use can lead to serotonin syndrome, an accumulation of serotonin in the body, normally caused by overuse of multiple serotonin-enhancing drugs, such as headache medications and antidepressants. Serotonin syndrome can cause anxiety, confusion, tremors, and rapid heart rate. When you cease taking SSRIs, it can cause symptoms of withdrawal, such as dizziness, lethargia, and flu-like symptoms. Heredity is also very influential in the effectiveness of SSRIs in the brain, making each individual more or less susceptible to the effects of them based on their family medical history. So to recap, SSRIs can have a large effect of serotonin. Serotonin creates positive impulses in the brain, but too much can be bad for the brain and have harmful effects. But SSRIs help treat serious illnesses that help many people live better, happier lives. Thank you for watching. We hope you learned something about SSRIs, their function, benefits, and risks. I'm Mac, Jordan, and Cam Film.